Hello, I wanted to speak with everybody about the current pandemic environment that we're in. That, as a number of you are aware of, we in the Commonwealth and in the National Guard in particular have been responding to this since March. And nationally and even internationally, the response has been a little bit longer. But whether you call it the pandemic or the COVID 19 or the coronavirus, I believe that this is a dynamic that we're going to be seeing and dealing with and will be impacting on our lives for months yet to come. And that'll be the case until we receive some sort of a vaccine that will enable the protection of all of us. While here in Kentucky, I believe that our governor has done a terrific job for containing the spread of the virus. And you may have seen where the number of cases has plateaued at this junction, that the number of deaths due to the virus has also tapered off. But still, it's had a significant impact. One noteworthy aspect that has caught my attention, a number you may be aware of, but we have had more U.S. citizens die due to this virus than the number of U.S. service members who were killed in World War One. And not only is it a greater number, but it's taking place in a far shorter time frame as well. And oh, by the way, that it hasn't ended yet. It's still ongoing. Uh, we've seen it spike in other states at this junction. So I believe this is a pandemic that we're going to continue to have to deal with in our lives until we get through it. At this junction, there are some things that we can do, and I'm addressing each of you for being members of the National Guard. For all of us in uniform, whether you're a full-timer or you're a M-Day soldier or airman, all of our neighbors, all of our family, all of our friends, they know we're into the military. And I believe by virtue of being in the military, we do have influence over them. We literally set an example for the conduct of our behavior, and in doing so, influence their behavior. So what I'm getting to, some of the things that we can do and should continue to do, first, to wear a mask where it's appropriate. And in particular, I share that because my wearing a mask isn't to protect me, but potentially I could be a asymptomatic carrier of the virus itself. I wouldn't show any signs, any symptoms, may not have a fever, and yet if I got the virus in me, I could spread it to others. So my wearing a mask is to protect you from me. You wearing a mask is doing a similar dynamic to protect the respective communities that we come from the spread of the virus. If you cannot socially distance from one another, and that means at least about a 6 foot interval, then wear a mask. And in addition to that, I'd offer we should be washing our hands a lot. Now, as we move forward and deal with this pandemic, I do believe, as I already mentioned, this is going to continue for a number of months. But I want all of you to be cognizant of what you can do to help prevent the spread of it, of the influence that you have in your respective communities. And in going forward, I just simply want you to be safe and be healthy and be aware of the public health environment that we're currently in. That said, I'm going to turn it over to Colonel Dr. Stewart, our senior physician in the Kentucky National Guard.
Thank you, sir. Certainly appreciate the opportunity to address all of my fellow Kentucky Guardsmen. The pandemic has been already a difficult, long road, and certainly in dealing with any event like this in life that is very prolonged, a lot of us fatigue with those daily efforts that we need to stay vigilant against this horrible virus. I know that we've been in the fight already for several months, and unfortunately, until we have a vaccine, we will need to continue to be very diligent with those efforts to ensure that we're keeping ourselves, our families, our communities healthy and keep from spreading the virus further. It's extremely important. I want to foot stomp what General Lamberton discussed. There are several measures that we can continue to do on a daily basis that are extremely important, and that is to social distance, at least 6 feet apart from others, to make certain that you're wearing your mask on a regular basis whenever you come into any type of prolonged contact with individuals, and as well ensure that you're washing your hands routinely on a regular basis for at least 20 seconds at a time. Coronavirus is a respiratory virus, and it's spread with respiratory droplets. Thus, one of the single best things that you can do is to wear your mask to ensure that you're not spreading the virus. Upwards of 20 to 50% of folks who develop coronavirus are asymptomatic, and so that's why it's so easy for it to spread because the individual doesn't know that they're ill when they encounter other individuals in their community, and thus wearing a mask is extremely important. Our state, from our governor's leadership, has done a wonderful job of keeping coronavirus at bay. Currently, we are at least plateauing with the number of cases. Unfortunately, there are some other states in which are surging, and again, the basics of what we all need to do to keep each other safe from coronavirus, such as social distancing, wearing a mask, washing hands, are likely the culprits in these other states for causing a resurgence of these cases. So please continue to be diligent every single day. Ensure that you are wearing your mask, washing your hands to keep yourself, to keep your family, your communities safe from developing coronavirus. Be the example and stay diligent with this fight that we will continue to fight for many more months until a vaccine is developed. Thank you very much.